coronavirus pandemic has exposed how scarce some needed medical supplies are. Experts say one reason for that is a law more than a dozen states have in place, including Minnesota, which is intended to reduce health care costs. Some say it's putting lives in danger. Valley News Team's Joshua Peguero investigates the law and its impacts on combating COVID-19.
Governors across the United States are pleading with the Trump administration for help in the fight against COVID-19. But about 35 of these states have laws in place impacting their ability to effectively respond. Minnesota is one of them. It has a statute that prevents hospitals from expanding or allowing new ones to be built, limiting the number of hospital beds. Professor Thomas Stropman of George Mason University says these laws are anti-competitive.
The certificate of need laws definitely have prevented the buildup of the number of hospital beds we have, and they're contributing to a shortage of ICU beds.
Stropman says these certificate of need laws hurt rural hospitals the most.
The statute in Minnesota requires first an application, and then the regulators decide not only whether there is need, but also whether the opening of a new hospital or adding beds hurts the competitor.
House Representative Paul Marquardt says when the state originally passed it decades ago, the idea was to lower health costs.
Bottom line is, when you have a moratorium like this in place, does it work for a pandemic? Well, no, absolutely not. It doesn't.
According to the Pacific Legal Foundation, 18 states suspended their certificate of need laws during the pandemic. Minnesota was not one. Marquardt says the state is getting around it by scouting for 5 potential sites for hospital beds.
The Director of Homeland Security and Emergency Management and the governor is looking at additional beds as the peak in the COVID-19 hits.
Marquardt says the state should take a hard look at this law after the pandemic is over.
I think this is going to be a situation where people are going to take a look at this to see, where is some middle ground.
On your screen are the number of intensive care unit beds in the valley compared to population size. ICU beds have ventilators, which are used to breathe oxygen in and out of a patient's lungs. Most rural counties in North Dakota and Minnesota don't have ICU beds. With facilities like Sanford Hospital right behind me, Cass County has the largest amount of ICU beds in the area, according to Kaiser Health News. Essentia Chief Medical Officer Dr. Richard Vetter says government and hospital leaders are partnering to prepare for a surge.
Both of our health systems have been upgrading and expanding and making sure that we have more ICU bed capacity than we would at our base level.
Although North Dakota does not have a law restricting hospital beds, Vetter says Minnesota's law is not an issue.
I think it's reasonable to make sure that we don't have overcapacity given the high cost of medical care. But I think when you're dealing with a crisis or an emergency, having an easy way to remove those restrictions and add capacity certainly makes a lot of sense.
But Stropman says Minnesota's statute and others around the country like it benefit large hospitals. In Fargo, Joshua Peguero, Valley News Live.
North Dakota passed a similar law in the 1970s restricting the number of hospital beds, but it was phased out in the mid-1990s. 2 more